Welcome to the launch of the Kamili Model. My name is Melanie Blake and I'm the founder and programme director of Kamili Organisation. Over the last 12 years or so, we have been helping people all over Kenya who have mental health issues. We started with a few clients in a small dispensary in Lower Kibeti on the outskirts of Nairobi. We now cover 43 of Kenya's 47 counties and we are growing all the time. Our experience as a team have led us to develop a model for community outreach care. It is a model that we have revised and refined, and it is a model that works. We hope that you will find the following presentation interesting, rewarding, and one that will provide you with food for thought. I am delighted that the presentation is to be given by Martin Wathika, our lead nurse and a Kenyan nurse and a Kamili nurse scholar. He is a very key member of the team that has worked so hard to develop the model and bring much needed care to those who need it most. Thank you.
A very warm welcome to the official launch of the Kamili Model. This is a model of successful community psychiatry care that has been developed by the Kamili Organization over the last 12 years. As you will see, the model is centered around the person and it involves a few key elements. I will outline the model for you as well as give a little more information about Kamili Organization. Mental health is a complex topic to understand, and bias and stereotypes have been at the center of people's perceptions. A human rights approach to mental health conditions require that we put the person first and adapt approaches that promote dignity. Kamili's mental health approach is a holistic approach addressing each determinant of mental health. We believe that the person is the center of recovery and can only achieve recovery if the medical practitioners, the person and the community work together to achieve this. Recovery for our clients means return to functionality and an improved quality of life. By addressing the social determinants of mental health and the medical condition through community outreach and integration into primary health care, Kamili has been able to develop a sustainable model, the Kamili Model. Since its inception in 2009, Kamili has seen over 15,000 clients, with some of the longest registered clients still returning monthly. Most of the clients who come to Kamili clinics are referred by word of mouth by clients who tried other systems of care which failed. As a result of the success of the Lower Kibeti clinic and distance traveled by client, the number of clinics in Kamili has grown from 2 clinics in Nairobi to 42 nationwide to address the need in the different counties. By adapting community-based services, Kamili has been able to reduce the number of admissions to national hospitals as well as reduce the cost of care for the clients. The average cost for care at Kamili per patient is 1,500 Kenya shillings, that is
only 10
GBP or
13
US dollars per year, making this model cost effective to all stakeholders, most notably to the government and to the person with mental illness. Kamili has put procedures in place centered around the rights of the individual. The person must give consent in all procedures. The person must participate in developing the recovery plan. The family's role is to support the person and not to decide for them. Above all, this is very much a team effort. Let's look at the 4 elements of the model. Element number 1, assessment and treatment. Kamili works with consultant psychiatrists, psychologists, psychiatric nurses, counselors, community health workers, and social workers. The professionals diagnose and construct a tailored treatment plan which includes counseling, medication, or referral to hospitals for complex cases that need emergency services. Element 2, counseling, psychotherapy, and occupational therapy. Core to the model is the use of alternatives properly to diagnose a client. Psychotherapy and occupational therapy help to identify the social determinants of mental health and aid in constructing a plan to address them, which may include attending group therapy, enrollment to community empowerment programs, or referral to other service providers. Further in line with a human rights approach to recovery, it puts the person in control of their recovery, thus making it more sustainable. Element number 3, microfinance. It is not enough just to treat a patient. We must help them build a future. As I mentioned before, successful recovery for our clients means returning to functionality and an improvement quality of life. Kamili helps patients save and secure loans for the purpose of financial empowerment. We believe in the patient's ability to learn, grow, and contribute to society. Through occupational therapy, patients learn small income generating skills such as juice making, sewing, beading, and baking. Element number 4, nurse scholarships. In Kenya, there is a general shortage of trained psychiatric nurses and specifically trained community psychiatric nurses. This was the situation in 2014. As Kamili, we ran a scholarship program to identify general nurses in primary healthcare with an interest in psychiatry. After training, they then returned to provide specialized mental health services in their counties. Kamili has 78 nurses trained in 43 in the 47 counties in Kenya. 34 nurses are currently in training. Kamili continues to grow and we are proud of achievements. The director, Melanie Blake, received an MBE from Her Majesty Queen Elizabeth II on behalf of Kamili Organization for services to mental health in Kenya. More recently, Kamili Organization was honored to receive an award from the United Nations, the United Nations Interagency Task Force on Preventive and Control of Non-Communicable Diseases, for their achievement in providing community mental health care services and commitment to battling the stigma associated with mental health. It is always nice to receive a pat on the back, but we do not rest on our laurels, and we aim always to do better tomorrow than which we did today. None of this would have been possible without the help of our partners, our donors, and our sponsors. For the first 10 years, Kamili raised its own funding through a couple of sponsored events. Bread and Water for Africa has been a long-term partner and has often matched the funds Kamili has received. We are eternally grateful to all our sponsors here in Kenya for their support over the years. More recently, Kamili has been successful in applying for funding from Comic Relief and Johnson & Johnson Foundation. Without their support, we will not manage. We are also working closely with the Ministry of Health as well as the Kenya Medical Training College. An element that is absolutely central to success of the Kamili model is the manner in which funds are used. We make sure that every shilling spent is for the benefit of our clients. We do not have smart offices in town. We do not have shiny 4x4s. Our team at Lower Kabete consists of only 6 people, and together with our network of nurses, we make a difference. Let's finish by returning to the model. At the heart of the model is the person. We have seen how effective treatment and care in the community, based around the 4 elements of the model, have resulted in people living with mental illness being aware, being able to lead productive, happy, and fulfilling lives. I am sure that you will have questions and that you will like to learn more about the Kamili model. This presentation and the notes will be available on our website from the beginning of next week. Please feel free to email us. Thank you.
My name is Dr. Simon Jogona. I am the Director of Mental Health. I wish to take this opportunity to congratulate Kamili organization on the launch of their mental health care model. This is a great achievement and show of their commitment to the transformation of mental health system in Kenya. Kamili as an organization has come a long way. It was set up in the year 2009. They only started with only 2 clinics here in Nairobi, and since then they have grown into 43 clinics across the country. They are providing affordable mental health care services to people in the low income setting and has helped a lot in the integration of community mental health into primary health care. They are also offering training scholarship for mental health nurses, and so far they have managed to train 78 nurses who are providing services across the country. This care model is cost effective and sustainable. It's very well aligned with the Kenya Mental Health Policy and the Quality Right Mental Health Initiative. It's a community-based and recovery-oriented model. It incorporates rehabilitation, reintegration, and sustainable livelihood in projects, which supports and empower persons with lived experience in their recovery and community inclusion. The model has also had substantial impact on the strengthening of mental health system through the training of nurses, provision of infrastructure for primary health care, and also provision of quality medication and counseling services. This has gone a long way in the decentralization of mental health services and making care accessible to most Kenyans. Kamili organization, together with other stakeholders, has participated in mental health promotion campaigns and activity towards the implementation of mental health policy. Moving forward, this model needs to be scaled up and adopted across the country. This will be an imperative step towards the reform of mental health care system in Kenya, and it will help in the achievement of universal health coverage, sustainable development, and the attainment of health equity. Thank you.